Hello. We are so excited today to have Christie Pearl come and join us and share about EMDR therapy as well as EMDRIA, which is a whole lot of letters, Christie, and we're going to get into all of that. Thank you so much for being on the show today.
Thank you so much for having me, Becky. I'm really happy to be here.
Um, we From looking at your website, I know you have so much training and you've been working in this business for several years. And so we're really fortunate to get to hear about your wealth of knowledge and how it is transforming people's lives. But with all of those abbreviations, EMDR, which people might be a little more familiar with, but then also EMDRIA. So go ahead and share with us about EMDR therapy and the difference between EMDRIA.
Sure. Yeah, I know that's a lot of letters. So EMDR stands for eye movement desensitization and reprocessing, and it's a mouthful. And essentially, EMDR is an approach to trauma therapy. It's what we would call a bottom-up approach, meaning most people that may be familiar with therapy might be familiar with talk therapy, which is what we would call a top-down approach. And top down versus bottom up means how we are getting at the material that we're wanting to work with. So essentially top down means when we engage in talk therapy, we're lighting up the part of our brain that has cognition and language and rationality. We're our thinking brain.
Okay.
And with EMDR and other bottom-up approaches, EMDR isn't the only one, but with a bottom-up approach like EMDR, we are going in through more of our unconscious mind, our implicit mind from the bottom up, which means we're going into the parts of our brain, or we're accessing the parts of our brain that hold implicit material. It's the parts of our brain that are unconscious. It's more body-based. And
Gotcha.
so we have different kinds of awareness. And most people, when they think of memory, they're talking about the thinking brain memory. Oh, I remember when that happened because I have words, I have a picture in my mind of that experience. I have words to describe it. So that's what most people are talking about when they talk about memory. But what the latest research in trauma and attachment tells us is that we have other kinds of memory. We have body memory, we have emotion memory. So the rest of our brain sort of gets left out in talk therapy. We light up the brain with the cognitive piece, but we don't actually do anything with it, which is why talk therapy for trauma is incomplete. It's often insufficient. We've got to get at where that trauma actually lives, which is in the body, in the emotion, the other parts of the brain, and then help them all kind of consolidate and link up. So we never want to leave out the thinking brain, but we want to bring up the other aspects of our body mind's way of knowing things. We want to bring that up from implicit memory into explicit, meaning we can now see it and think about it and talk about it, and then allow those to blend together to bring things to resolution. We can't bring trauma to resolution by just talking about it because we've been lighting up the thinking brain without allowing there's a whole lot more to that experience that's living in a different part of our brain. So EMDR, in a nutshell, helps us access all of that and bring it to resolution, help you bring to resolution today something that your system could not bring to resolution at the time because it was too overwhelming. And that's the definition of trauma, something that we can't integrate, we can't consolidate into our experience in an adaptive way because it's too overwhelming. So I know that might be a long answer, but that is in a nutshell what EMDR is. It's a way of working with the brain, with all of the parts of the brain. So in a nutshell, EMDR helps us access all of the material so we can take the part that's in our thinking brain along with the implicit material that's in our emotional memory, in our body memory, and we can consolidate that and bring that to resolution. We can help the person bring that experience or pattern of experience to resolution in a way that they couldn't at the time, because by definition, the experience was too overwhelming.
Thank you. I know you said it was a long answer, but a long scientific study on that needs a long answer, and I find it personally fascinating. So thank you for breaking that down. And I'm an elementary school counselor, and we talk often with teachers about, triggers and things like that. And it's like trying to help people understand the child may not even know why they are freaking out over something to us that isn't important, or wouldn't seem like it would bother them, and colors, smells, so many things. So there's so much there. And then just if you can add on a little to EMDRIA, is there a little bit of difference in that, or talk to us about that for a little bit?
Yeah, I'm happy to clarify that. So EMDRIA is simply the EMDR International Association. So EMDRIA, as we kind of call it, is the governing body of the practice of EMDR. So it's the international association that certifies EMDR clinicians. I am a certified EMDR therapist. So there are, requirements that you have to fulfill, just like for our license in general. Right. When we go on to specialize in a certain modality, there's often a governing body, an association that then certifies your work in that area. And so the EMDR International Association is that governing body, and it's also, the research center. It's right. Our professional association, just like I have my professional associations as a counselor, the EMDRIA is my EMDR professional association. So very much involved in research, in training, in education, public awareness about EMDR. So it's sort of our home base as EMDR clinicians.
Okay, thank you. That makes so much sense. And that just makes me think, because a lot of our listeners are considering going into the field of counseling or mental health. Can you talk to us, since you're part of that group? Is this something they would be certified in a university program, master's, or talk to us about where you can be trained in that? Is it very accessible? Or is it like a special training through your governing agency?
Mm-hmm. So I went to graduate school a long time ago.
I did as well.
So I don't feel super up to date on what is being taught now. I mean, we're going back, 20 years for me. So unless something drastic has changed, I sort of doubt that the graduate training has caught up to where the counseling field in general is in terms of approaches, top down, bottom up. If someone knows different, let me know, because I would love to be proven wrong on that. Yeah. I would love to have more trauma informed education. But that being said, graduate school is graduate school. You've got a lot of basic skills to learn. And trauma in general is something that you probably come to specialize in later. Graduate school can't cover everything. So trauma is even setting aside EMDR for a second, and the particular approach you're going to take in your modality, trauma in general is an area of specialty. So I wouldn't expect that to really be covered in a meaningful way in a graduate program. You might get some experience in your practicum or your, fellowship or, things like that. But so I don't think EMDR is really being covered in graduate programs. But again, if anyone is more knowledgeable on that than me, let me know. Later, after you graduate, you would then decide what is your area of practice going to be. And for many people, they might find themselves dealing with trauma. We're all working with people with trauma, whether we want to or not, because trauma is sadly ubiquitous. So whether you specialize in trauma or not, you're going to be working with people who've experienced trauma. But if you want to specialize in that, then that's something you would choose to do later. And in terms of getting trained in EMDR, I mean, I would love for everybody to be trained in EMDR or any other of the bottom up approaches. So in terms of training, it's important to know and make a good decision about where you're getting trained. There are so many trainings out there. I will say that EMDRIA, the International Association, certifies trainings. And so it's important, if you're wanting to become certified in EMDR, it would be important to choose a training that is approved by the association. So there are a lot of choices out there. There are a lot of different, trainings offered. It is a big commitment. So the training to become EMDR, even just basic training. So maybe it would be helpful if I just described the levels. So let's say you finished grad school, you've got your master's, maybe you've worked towards your license or you're working towards your license. You certainly don't have to wait until you're licensed to get trained. So I think that is also important. But so the levels of EMDR proficiency would start with basic training, and it's a 40-hour training. It's a big commitment, both time-wise and financially. So that's basic training. Basically teaches you, it's just that, it's basic. It teaches you the standard EMDR protocol. And so many people take that training and come out of there feeling like you just got fire hosed with information.
Yeah.
And, I think a lot of people feel it's kind of like mind blown, because it's so different than anything you've learned, or if you've been practicing for a while, it's so different from what you've been doing as a talk therapist. So it really is a complete shift in the way you think about working. And that can be really exciting. It can be overwhelming, and it's probably a little bit of both. So when you do your basic training, you're also doing a few hours of consultation with someone like me, who is, in addition to being certified, I'm a consultant. So I'll explain that in a minute. So you're getting a little bit of supervision around starting to use the model. And then you can go on from there. And really, if you are going to be using EMDR in your practice, this is my opinion, I think it's important to go on from there, because basic training is just that. It's basic.
Right.
So EMDR started out as a symptom relief model. Someone had experienced a trauma, and they had experienced a shock trauma. So something happened to them. Like, let's say, like a car accident or a, natural disaster, like someone experienced a flood, or, there was an event that they were experiencing symptoms from. And so EMDR, the standard protocol, started as a symptom relief approach to that. Something bad happened to you, and we can use this model to relieve the symptoms.
Okay.
Bring that experience to resolution, like I talked about earlier. So
Mm-hmm.
that was the origin of EMDR therapy, and that is what's taught in basic training. And a lot of people don't understand this. So in basic training, you're taught the basic protocol for symptom relief.
Okay.
But as we know, that is not enough for working with people with complex trauma,
Mm-hmm.
because complex trauma is what brings most people to therapy. Not all, but anyone coming to trauma therapy is likely coming because they haven't just had one overwhelming experience. They have had a childhood,
Yeah.
a pattern of
Yeah.
not just bad things that happened to them, but good things that didn't happen.
Important. Yeah.
So we're talking about attachment trauma here most of the time. And so symptom relief doesn't work for attachment trauma because you can't target something that's not there.
Mm-hmm. Yes.
So if we are going to use EMDR in psychotherapy as an approach and not just as a technique that I whip out when I want to relieve symptoms on something, then we have to go beyond basic training. We have to, you know, we have to do advanced work and learning how to use the model in a more sophisticated way that we can fold into our overall approach as a psychotherapist, as a therapist, as a counselor. And so basic training doesn't teach you that. And it can. Again,
Mm-hmm.
basic training is basic. So for people who want to go on and really become proficient in using EMDR in therapy with people with complex trauma, then certification is the next level, which means you're doing additional training, you're doing advanced training, you're getting additional consultation, meaning your work is being evaluated, that you understand how to use the model. And so that's sort of the next level. And then the next level up from that, which is the level I am, is consultant, which means you've been certified and now you've had further training, further evaluation, and you're now providing consultation to others who are wanting to learn how to do that.
Okay.
So that's
Yeah.
maybe more information than you wanted about.
No, I think it's great. I think we have not covered any of this in any of the shows, so I think it's very good. And I think for people maybe beginning, middle, end of their graduate school, I'm sure the term is at least being tossed out as like something to reach out for in the future. So very helpful. So thank you for clarifying that. Let's talk about your clients a bit, not specifically, obviously, but you specifically try to work with adult children of alcoholic homes or alcoholic parents, or maybe just dysfunctional families in general. So just talk about that. Like, how do they find you? What are some patterns you're seeing? Let's hear about that.
Yeah. Well, some people find me because they identify as ACOA. So that adult child of alcoholic is sort of an acronym that is meaningful to some people who, it's actually a 12-step community. So there is actually a 12-step, ACOA world that acronym ACOA has meaning for people who are connected with that and who obviously have the awareness that they are
Right. That
adult
this isn't how all
children
homes are.
alcoholics.
Yeah. Okay.
Yeah. And so that term is meaningful to some people. And so some people find me because that term is meaningful to them and it's not like I'm speaking their language.
For sure.
So other people don't necessarily identify with that acronym, they might not even know that they are that the experiences they're struggling with are related to their childhood or their having a parent with alcoholism.
Okay.
And then other people, I think it's important to know that you might not have had a parent with alcoholism, but you could still be experiencing the same symptoms, the same patterns in your life with other types of family of origin dysfunctional relationship patterns. And so, maybe it might not be addiction, but maybe it's a really perfectionist parent, or maybe there was, extreme punishment. Maybe there was emotional repression. Maybe there was, the common denominator is really any experience in family of origin where there's emotional abandonment.
Okay.
There might be chaos. You might have a narcissistic parent, for example. You might have parents with other types of mental illness who, for whatever reason, are not emotionally available to you. So this
Okay.
definitely falls in the category of some of those good things that don't happen enough. The nurturing you didn't get, the protection you didn't get, if your parent can't care for you. So I like to say that we're not all children of alcoholics, but most of us are ACOAs because most of us have experienced some kind of emotional abandonment. Many of us have, at the very least. So any early family experience that results in a sense of being emotionally abandoned, not having the caregiving that any child would need to have emotionally and sometimes physically as well. So that is how people find me. Some people find me because they are interested in EMDR. Some people find me because they want to do intensive work as opposed to, traditional therapy. So people find me for different reasons.
Okay. When I was looking at your website and you were talking about maybe different people you could help, there was some themes in there about the clients you would have, whatever they were dealing with in their childhood, and then now applying it, and they're experiencing trouble and extreme stress at work, or they're trying to be perfect. Can you talk about some of the patterns or things that people carry with them into their adult life? And maybe there's listeners who are like, oh, maybe this is what I'm dealing with. So,
Yeah. Yeah. So whatever our experience is when we are young, whatever's happening around us in our caregiving environment, in our relationship environment, we have to adapt to that. So if I have a parent who's struggling with addiction, they're likely not available emotionally to me. Maybe they're even scary sometimes. There's probably some unpredictability. Those are some pretty common themes. And so as a child, you have to adapt to that. And we all make these adaptations. So I might adapt by beginning to really stuff my feelings because it's clear. And this is back to that implicit mind. This is not an explicit thought that any child has, but you learn that the grown-ups around me can't manage my feelings. They're too preoccupied with themselves. So I'm just going to stuff my feelings and try to be as best a little person as I can so that I don't cause them any problems.
right.
And so that's an example of an adaptation. And we take these adaptations and they kind of can take on a life of their own, and we take them into our adult lives unless we do work on them, unless we bring them into our explicit awareness. And so in adulthood, if I've got that adaptation of I stuff my feelings and I try to be as good as I can and not cause anybody any problems, then in adulthood, that's probably going to result in you not getting your needs met.
Mm-hmm.
Because if you're struggling to communicate your needs, if you're trying not to cause anybody around you any problems, you're probably struggling with assertiveness, you're struggling with getting your needs met. And at work, people are shocked often to realize that the same patterns they're having a hard time with at home are the same ones that they're having a hard time with at work.
Okay.
People sometimes have this magical thinking that you don't take your personal issues to work with you, but we do.
Right, right, for
And
sure.
so if you have trouble getting your needs met at home, chances are you have trouble with that at work as well. And
Yeah.
so that can start to look like, some overachieving, some always raising your hand, I'll do it, picking up the slack for other people, kind of running from one thing to the next, jamming your schedule, trying to fit it all in,
Mm-hmm.
trying to be good enough. And again, these are sort of the unconscious drivers of our behavior.
Mm-hmm.
You probably know you're doing it, but can't seem to stop doing it. And
Mm-hmm.
that's the place that often brings people to therapy is I I know what I'm doing, but I can't seem to stop doing it. So there's this conflict on the inside. Like what I say I want is to be able to take more time off and actually relax when I'm at home,
Mm-hmm.
or take a vacation without feeling guilty about it,
Mm-hmm.
or say no when, for the 100th time this week, somebody asks me to do something for them.
Mm-hmm.
I say I want to do those things, but I can't seem to do it.
Okay.
And that's where we sit when we've got a conflict between the adult part of us that knows, like, I'd really like to be able to take a vacation and not feel guilty about it. But
Mm-hmm.
those implicit drivers, those old adaptations that are baked into our nervous system from
Mm-hmm.
childhood are compelling us to keep doing the same thing over and over, which is overdoing.
Mm-hmm.
Does that make sense?
Absolutely. It brings many names to mind for all those different reasons. As you know, I think most people who work or, anyone who's alive, you're seeing people around you dealing with those kinds of things. So I did want to ask you with the complexity of the issues that you're helping people with, and meeting people where they're at, what are some of the I don't know if I like the word barrier, I think boundary, but professional boundaries that you even have for yourself in being able to put your best foot forward, helping people with these very deep issues, which I'm
Mm-hmm.
sure are often incredibly sad. And then how, I guess, are you taking care of yourself? And even you seem like very logical to me, but logically planning to say, this is where I have to cut things off. These are the times I'm open for clients, all of
Mm-hmm.
those things.
Yeah. I really appreciate that you're asking this question because I think it belongs in every conversation when
Mhm.
we're talking about therapists doing their work. And I am more than happy to talk about boundaries because my my practice can only be as healthy as I am.
Mhm.
So if I am not healthy, my work will suffer. My practice cannot be healthy in terms of the things that you're naming. My boundaries, the times I work, the times I don't work, the times I respond to client emails, the times I don't respond to client emails. So I think that as therapists, we can often our field has a lot of baggage around this. The mental health field has its own trauma history, and
True.
we are taught to sacrifice at our own expense. We are literally taught that. Probably anyone listening to this, myself included, was told in grad school explicitly and implicitly through kind of messaging that I needed to sacrifice myself for this work.
Mm-hmm.
And I reject that just wholeheartedly. I reject that.
Mm-hmm.
And I actually think that it just, I just can't wrap my head around how that makes any sense. Because if I am required to sacrifice myself for my work, then we've got problems. I am not modeling healthy boundaries for my clients, and I am probably not well. But I mean, we know this is the stereotype of the exhausted, overworked, overbooked therapist.
Mm-hmm.
Even in private practice, when we are in control,
Mm-hmm.
I am in control.
Yeah.
So, but how many of us repeat our own trauma patterns, both our personal trauma history and the baggage that we learned in grad school and beyond?
Mm-hmm.
So I work with the therapists I work with, I really work to help them decide what they want for themselves. And so I think that, in terms of boundary issues, I think doing your own work, if you are not doing your own personal therapy, and it doesn't mean you have to be in therapy all the time, but you have to do your own work. You have to have done your own work, and it's an ongoing process. Maybe you notice something coming up between you and a client, and it's pushing some buttons for you.
Mm-hmm.
So maybe I go to my therapist then, and we do a piece of work on that. I kind of lean into that. What's that about? What's coming up for me around that? We've all got blind spots. So I'm a big believer in ongoing learning, ongoing development personally and professionally. So I think we have to do our own personal work, number one. And number two, we have to have good policies in place. We have to be really clear about what are the expectations.
Right.
And that's, I feel like over the course of my practice, I'm sort of periodically revising my policies based on experience. So something will happen, and then that will kind of tell me, oh, I need to make that more clear in my policies. So it's not a set it and forget it by any means, but I think, we have to have clear policies and set expectations from the beginning, and then follow through. And again, my practice is only as healthy as I am. So if I am not respecting my own boundaries, then my clients probably won't either.
Right. Yes, I feel like on the last 10 episodes, we've heard that a lot. Like, not that it would be bad if a therapist or coach is in therapy all the time, but definitely going in for a specific thing they want to work on. And I liked how you broke it down, even knowing a certain type of client, maybe it's a certain time of year that's more difficult, and going and being proactive on that and not waiting till you're exhausted, overwhelmed, and back into your old implicit habits. So
absolutely.
Thank you.
I could not agree more.
Yes. Well, we've talked a lot today about so many great things. Is there anything that you feel like you really want us to know about your practice, or part of the group? I'm not going to try and I am going to try and say it. EMDRIA. Did I say it right?
Yeah, EMDRIA.
EMDRIA. Yes.
Yeah,
EMDRIA.
there you go.
Any other things that you feel like you'd really want our listeners to know if they're considering this field or in the middle of their studies?
Yeah. Well, like I said earlier, I would love for everyone to get trained in EMDR. And I'm not a trainer, so I have no skin in that game. But I think that there is tremendous value in that work, both for ourselves and for our clients, because I've done talk therapy, and I've done EMDR therapy, and I wish I had had EMDR therapy a lot earlier in my life.
Mhm.
I think if I had had a good EMDR therapist back in my 20s, like things could have been pretty different.
Mhm.
I had really good talk therapists back in my
Okay.
20s. So, there's value in that. But I think that really to be able to heal, I just invite people to be curious about trying something different, trying something new, and being ready to really evolve beyond um, talking about it, thinking about it, and more towards actually being able to heal, because this
Mhm.
world needs healing more than ever. So
Mhm.
we've got to be we've got to be healed ourselves, and then we've got to be able to really hold that space
Mhm.
for other people in a meaningful way.
Very inspiring for sure. And a lot, I'm sure you've given us a lot for people to think about in who they want to work with. But this type of specific therapy can help people of all ages and stages. So thank you for giving us a whole lot of information and knowledge about that. And I think will prompt people to do more of their own exploring. So thank
Yeah.
you so much for being here today and giving us your valuable time, Christie.
Thank you so much for having me. I really appreciate it.
To our listeners, we are so thankful that you're tuning in to Mastering Counseling. We hope you review our old episodes, as we have so many experts on many different issues. And we look forward to the new the new therapists and counselors that we will talk to in the future. Please send us your questions, give us your comments, and reach out for more information. Have a wonderful day. Goodbye.